So this gentleman has acne scars, and I'm doing Botox treatments for him. Am I crazy? Maybe a little bit, but I'm not crazy in terms of dangerousness. This is really, really effective. So as a little history for this gentleman, he has had already some silicone rounds, microsilicone injections into the dermis to elevate some of the deeper holes. Now, he's still in the early swing of this, so he's not gotten all the results of that, because silicone really takes a while to build up those deep areas. But there are certain things that silicone simply will not work on. So silicone works on the deep holes, and I do it in a very safe fashion to elevate those areas without risk of granuloma that I've seen or anything in 20 years. I get very safe results because I use silicone 1000 for that. And it's a progressive elevation of the dermis. The problem with silicone is that it doesn't fix everything. So for him, he's got sort of fine etches, some pores, some texture, discoloration. The skin just doesn't look as healthy. And believe it or not, the Botox doesn't only manage a lot of those little things, but it also manages problems with acne. Now, he may not even have a lot of acne left, but I can take cystic acne and even active acne and reduce it. In fact, my wife recently mentioned, he says, you know, your son has a lot of oily skin like you. He's going to have a lot of problems in his teenage years. What are we going to do? Are we going to do Accutane? I said, no, we're going to do Botox. And after a couple rounds at 13 years of age, you probably won't even have any scarring or acne. So that's the power of this. Now, the natural question is, when you're looking at doing this therapy, is this going to be something that will be gone in about 3 months? And so this is the mistake of looking at Botox as a wrinkle reducer and making it equivalent to treating acne scars and acne. And remember, again, acne scarring, I'm not treating the deep scarring. The deep scarring simply, this will not make a big enough difference. It's the superficial scarring. But the scarring is actually long-term. He should have an amazing result after a few rounds of this, where if he stopped doing this for years, he should be fine. Now, to treat active acne, no. I mean, that could shut it down. I have a lady that, as I was mentioning, that I did a few rounds on, and I don't even see her maybe once every 2 years. But that is, scarring, it should help significantly. Now, I'm actually going to manage these scars and pores on his nose. Maybe a slight more discomfort. You okay? Mm-hmm. So, in fact, I'll tell you a story too. I had a gentleman that he had a Mohs surgery with scars on his nose, and he had problems with pores and texture and scarring. And I did a couple rounds on his nose, and he was getting compliments how great his nose looked. So I did his whole face after that, and people are swearing they did a laser, and absolutely not. So let me tell you a actual study. Let's go to this side here. Keep filming there. So there was a study that actually yeah, you can come over this way. Yeah, come over that way. Good. Yeah. So there was a study.
Sorry.
Okay. Yeah.
Okay,
Good.
there we go.
There was a study that looked at scarring. It was for a thyroid treatment, where a thyroid scar. So it was a linear scar on the neck. Half of the scar was injected with Botox, and the other half was injected with saline, which is a placebo, at 1 week. And the patient didn't know, the doctor didn't know, and 6 months aside with Botox basically had no scarring. And so if you think about that, I've seen it, I've done a traumatic scars, and I've been able to correct it with Botox. So the thing that people don't understand is the power of what Botox does long term. And for acne scars and active acne, people think, oh, this is just a temporary fix for 3 months. It absolutely is not. So the question is there any risk of doing this? Is there any downside, negative? So the great thing with Botox is no. Long term, there is zero long-term risk. Only really incredible benefits long term for this. And I would usually recommend to do this every 3 to 6 months, depending on someone's budget. But then there is one short-term risk, and it's a risk that I don't see in every single individual. But the risk is the smile can be a little tight. Now, I do my wife every few months, and I'll tell you, her skin and everything looks so much better. So, I don't do it just for acne scars. This video is really about acne scars. But this is really something powerful for overall skin therapy. Sort of a classification of how I look at Botox for just to look at acne scars, I divide it into large, medium, and small. So in other words, big cavities, medium cavities, and tiny ones. The bigger holes and the medium holes, silicone works the best, and it does take multiple rounds to get there. Of course, in unskilled hands is very dangerous, but I've been doing it for 20 years with remarkable results. And then the medium holes that are just sort of a little bit more etch work, that are medium to small, those I use a radiofrequency microneedle device that will help with getting the texture better. The problem with that microneedle is that for color, pores, tone, and smaller little edges, it's not really going to be that effective. It's too small. Like these little tiny pores that you probably can't quite see on the video really are not going to be significantly improved. But this bigger hole, like in his temple, even though some discoloration, which I'm treating with it, will be mildly improved with the Botox long term, but he really needs a silicone for that. So for him, he really is, I don't think he has a lot of things that absolutely need microneedle. It could help him, but when I look at him, he has a combination of big and small. He's got big problems in terms of the acne scars that need the silicone. He's got small problems, discoloration, a little bit of tiny pore issues, a little bit of texture problems and discoloration that will be helped with the Botox. So that's basically how I do Botox for acne scars and for active acne.